And we are moving into chapter 14, family therapy, working with families and intimate couples in relationships to nurture, change, and development. Very different than individual therapy, it's a different skill set. There are many differences between systemic or system family systems therapy and individual approaches. Um, you would explore the family system as a family systems therapist using a genogram. You would invite the family into therapy with your client. You would focus on family relationships that contribute to the issues that each family member is bringing. And you look for transgenerational themes and issues within the context of the family. And if you have a client that you brought the family in to do family therapy with, you would intervene to help change your client's context. There are a couple of different influential theorists that you need to know about. Murray Bowen, Bowen Family Systems, Multi-Generational Family Therapy. And then Alfred Adler, of course, was someone in Dreikers. They were really the first known theorists to discuss family therapy and often used a model that we call open forum family counseling. Um, remember Adler had the family constellation. Remember when we did that in Adlerian and the assessment? So think about Adler, very focused on the family. Now Murray Bowen, he is the one who analyzed the families from a 3-generation perspective, and he was looking at that multi-generational those themes across generations. He also talked about triangulation in families and and how we become enmeshed with family members and we have to detangle ourselves from those family interactions. Um, and his is multi-generational family therapy. We also have Satir, Virginia Satir. Here is the Genogram, and you will have a marriage and family therapy class. But this is an example of a 3-generation genogram. Here, there are different symbols. You do not have to do them uh, this intricately, but this is the way you do them. You get to do them with Dr. Muller. You see all the different symbols. So you would draw this out for 3 generations, and you see how you would do the squiggly line for violence. So those mean different things. And then we have Satir. She's very influential in family therapy. She's on the back page. Oh no, she starts on page 407. She's an intergenerational model, and she also did sculpting, where she invited people to sculpt their family, which is very powerful and something I use today. Um, she really worked on the relationship, and let's see what else I want to say about her. And Satir really focused on communication. She focused on empathy and compassion for one another and meta communication. We're just really making sure that the family is in tune to one another, is responsible for conjoint family therapy. So know those theorists. We also have Carl Whitaker. Carl Whitaker was a professor at University of Wisconsin-Madison, and he was heavily reliant on existentialism infused into his family approach. And in family therapy, he really saw himself as more of a coach role, and he looked at the family as out of balance and tried to help the family return to homeostasis. There's Minuchin and others as well. Just make sure. Yeah, no, we need to talk about Minuchin. Golly, I didn't do a lot on this, did I? So let me make sure that I cover everything you need to know for the exam. So also structural family therapy. It was designed by Salvador Minuchin. It's traced to the 1960s, and the research on that was done with delinquent boys. The goal of structural family therapy is to reduce the symptoms of the dysfunction and bring structural change within the system by modifying the family's rules and establishing more appropriate boundaries. And that's easier said than done. He's also accompanied by Haley, J. Haley. So Haley and Mnuchin are two names that you need to know. Structural Strategic Family Therapy. In your text, 408, even though it's not in the PowerPoint, you need to know that. It was one of the most widely used models in the 70s. Their interventions are synonymous with what we call the systems approach. It's joining, boundary setting, unbalancing, reframing, ordeals, paradoxical interventions, and enactments, subsystems, and like looking at your family system and then dividing it into different subsystems and analyzing who has the power, who's aligned with who, all of those things that you probably already are aware of. There are more recent innovations in family therapy like postmodern and feminist, narrative therapy, etc., that can be used and applied in family systems as well. The assumptions for this theory are the individual is from this family system. So some of the assumptions, it's very different than individual therapy. We talked about this already. It's a difficult to grasp family therapy a lot of times because we look at everything from more of an individualistic perspective. But we are attached to our families throughout our entire lives. That's how we discover who we are, we develop, and we change. And we give and receive support that we need for survival. But all of our families live by a set of unspoken rules. We all have these family rules, and we don't really understand that they're there until maybe we're older sometimes. So, and to assess the family that you're working with, you would want to see how they interacted and what were their basic set of rules that they operated by, maybe that had been passed down generationally. It may have been something that they learned from their ancestors. It serves a function. It may be maladaptive, but it does. And like I said, it's handed down. Dysfunctional patterns are handed down through the generations, like lack of boundaries, abuse, trauma, and the way that we parent. Not cutting people off is a big one. Where, well, I just don't. Your aunt and I haven't spoken in years. You will hear that a lot. It's very sad to me. I don't think every once in a while something is that bad, but not often are things that bad that we should not talk to our loved ones. And in class, we're going to do the case of Anne. I'm taking notes here. So we'll do the case of Anne in class, but I believe Anne's in your text. If I didn't give you Anne, let me see. Anne. I think Anne's in your text. Yeah, because Anne's right here. Yeah, Anne's in your text. Let's see. I give you the case of Anne right there anyway. So that's the case of Anne. Age Anne sees age Anne. Oh my gosh. Anne, age 22, sees a counselor because she's suffering from depression that has lasted for more than 2 years and it's impaired her ability to maintain friendships and work productively. She wants to feel better. She's pessimistic. How will the therapist choose to help her? So we'll talk about the case of Anne in class next week when we're actually together. I hope we're together. And now, of course, the diagnosis would be DSM-5. So that's an old note there. I need to change that. But this is the differences between individual counseling and family. We're not going to diagnose a family. I mean, we could, but we can only diagnose really one person. We usually only work with the individual and we bring family in if we have to. But usually we just work with the individual on their thoughts, feelings, behaviors. And we develop goals and we help them. And we use a theory to meet those goals. In the family, we look at the whole system. The whole family comes to therapy. We may do the family rules, the genogram. We look and analyze the entire family system in the session. And we consider those transgenerational themes that are passed down. You work with and help the family to change. Or the client that was first identified that brought the family in. You help change the context of the family. So you see how it's different, and I know that you are noticing what a skill set that must be, because it most certainly is. It's not the same as what you've been learning, and if you like this is something that you should gain specialization and more training in. And the process is much the same. You're still forming a relationship. You're still forming a relationship, conducting assessments, either observation, projective, or formal. The genogram is a type of assessment. It's a data gathering tool. And then you're going to hypothesize. You're going to think about um, things that are going on in this family. What are the themes? You're able to talk about things and share meaning. Um, and you help to facilitate change through that process. Like I said earlier, an assessment is a genogram, and genogram, how to do that is on page 411. And I think when we go to class, we may start a little bit of that, or I may just leave that to Dr. Muller because he's going to do that with you guys, and you do that for a project. So you'll get more on that. You don't have to know too much. Just know what it is and know that it comes in this theory, please. And we know that forming a relationship is of the utmost importance, especially in family therapy. And it go through the genogram and just go through and make sure you understand what a genogram is and what kind of questions you would ask in that process. There are a lot of strengths from a diversity standpoint, and then there's a great genogram here for Stan. And let's look at Stan and Gwen when we go back to class. Let's look at Stan and Gwen. These are shorter chapters, so hopefully you guys will read these and listen to these. Know the theorist, know the terms. There's not too much in this chapter, but it should be pretty easy. This final should be far easier than the midterm because I think the theories are just easier. That was short. I feel like I need to tell you guys something else. Is that all I have to say? Goodness. Okay. Yay for you guys.